I'm Dr. O, and I'm your regenerative medicine doctor, and this is day 19 on our journey of 60 days to 60. Do you have neck pain and go to your doctor and they ask you to get an x-ray or an MRI and look at the MRI and x-ray result and say, you need this injection, and then that's it? Do you feel that your problem is being addressed or just your symptoms? Some people have neck pain because they sit at a desk all day. Other people have neck pain because they lift weights and maybe they're doing it improperly. But no matter how you got there, neck pain can be real and very interfering. But before you treat the pain, it's really important to understand its source. Is it really your neck? Sometimes neck pain is actually from problems that stem from your shoulder, whereas sometimes shoulder pain can actually look like neck pain. So it's important to really understand whether you have neck pain or whether you have shoulder pain or even a combination of both, because that can happen too. How do we address our neck pain? So the most important thing about neck pain is what we call alignment. For most people, our heads weigh anywhere from 10 pounds to 12 pounds. Having a big head that's sitting on a skinny spine can be a source of pain if that head isn't perfectly aligned with that spine. So to make sure that you're aligning your spine, there are a few things you should know. So the first thing you want to do is look at the setup at your desk. Ideally, you want the top of your computer monitor to be around the level of your eyes. If you have the computer any higher, you will find that you extend your neck back and you jam those joints called the facet joints. Do you remember those? If you have the monitor too low or are working on a laptop, which a lot of people do, you will find your neck leaning forward. So when your neck is forward, the weight of your neck can no longer pass through the spine, but instead stops at your neck. And that's how you get neck pain. The next thing you should think about is your shoulders. First, you want to make sure that your elbow does not move too far away from your body. Also, you want to make sure that your elbow isn't bent too far. Another thing to consider when you're thinking about managing your neck pain is to explore how you're doing your upper extremity exercises. The middle of your back is flat. As you move away from the center, when the ribs start to appear, they curve. Your shoulder blades are designed to sit on the flat part of your back. But what happens when you slouch? Your shoulder blades starts to move away from the center of the back and they end up sitting on your rib cage, a curved surface. Imagine a book on a table, stable, or a book on a ball, unstable. When you're doing your upper extremities exercises, it's so important to make sure you are engaging these muscles to keep your shoulder blades on the flat part of your back. If you don't do this, you will be working in an unstable position and eventually will get low back pain, not to mention shoulder problems. I'm Dr. O, and I'm your regenerative medicine doctor, and this is day 19 on our journey of 60 days to 60.